Good evening, everyone. This is Dr. Shruti Banka. I am Senior Consultant at Indira IVF Muzaffarpur branch. So today we will discuss in brief about what are the basic tests which a couple should undergo if they are not able to conceive for more than a year or two. So first and most important test is a transvaginal sonography, which we can do twice in the cycle. First, on day 2, we can come to know about what is the ovarian reserve of the female by knowing the antral follicular count which we see in the ovary. Other than that, we can come to know about any anatomical defect if there is there in uterus, fallopian tube or in the ovary. Then we can repeat this transvaginal scan on day 14 to check out if the female is ovulating or not and if the endometrium is having the proper thickness and blood flow or not. To add on this transvaginal sonography, we can have a hormonal assay which can be done on any day of the cycle and any time of the day. That is AMH, Prolactin and thyroid stimulating hormone. These two tests of the females can tell us most of the disease of the infertility which can cause the issues. Other than that, we can go for general health checkup of the female, like we can do viral marker, blood group, complete blood count, liver and renal function test. Other than that, some screening tests like thalassemia screening, pap smear, rubella test. So other than this, about the male partner, if you go, general health checkup, and other than general health checkup, we should do a proper sperm analysis. Sperm analysis is one of the important tests. Sometimes people think that knowing the count and motility is more than enough, but more than that, morphology of the sperm is more important. If morphology of the sperm is not good, even if you have a very good count, that will not help. So doing a transvaginal sonograph, doing a few hormonal analysis and a proper semen analysis. In around 70 to 80% of the cases, we come to know the reason, whether it's there in the female or in the male partner, but only 10 to 15% cases we are not able to find any cause. In those cases, we should go on second phase of the testing, that is doing Tubal patency test, which can be done by hysterosalpingography, which can be done on day 6 to day 11. This test we can do by a simple Lapidary test also, and in male we can do a DNA fragmentation index of the sperm, which will tell us about what is the fertility potential of that sperm. Sometimes if both of these tests are normal, then we should focus on the caliber of the fallopian tube. Sometimes in HSG we see that the fallopian tube is open but it is swollen, it is beaded, it is very stuck in the uterus, which we can see in transvaginal sonography. So these all things can also lead to infertility, but the direct cause is not evident in the blood test or in HSG. So after knowing all these things, we can decide what should be the plan and what treatment we should give to the couple. So a proper testing and knowing the reason before starting the treatment is very, very important. Thank you so much.